Howdy, welcome back to another lecture. This one we're going to talk about vital signs. So what are vital signs? Vital signs are an outward clue to what's going on in the patient's body. Vital signs include pulse, blood pressure, and respirations. Technically, if you hear the nurses talking, they also include temperature. We do assess temperature, but it's not necessarily with the thermometer. We kind of assess and go, warm, cool, hot, normal, not normal. So temperature is technically the fourth vital sign. For us, we care about the pulse, the blood pressure, and the respirations. We always want to assess a baseline or a kind of a first set of vital signs to provide a basis of comparison for later sets of vital signs. Now, one of the key things, don't confuse vital signs with initial assessment. Vital signs don't actually happen until you get to your physical exam and your secondary assessment. Once you're past the initial assessment, that's when you get your vital signs. So it's important to monitor trends in vital signs rather than individual sets of vital signs, which means you should always have at least two sets, although, because 2 points defines a line, right? If this is your heart rate here, and here it's at 120, well, it kind of looks like it's going up, but maybe if you check it again here, it's back down to 100, and maybe it just goes back down to normal. So you want to establish a trend for vital signs. So the first one is pulse, and the pulse is you're actually palpating the blood moving through arteries. So the heart squeezes and it forces blood to go around in your body, and you can feel that squeeze as it moves through the arteries that are shown here. There are a few different pulse points. So you have, on your conscious patients, you typically assess at the radial, and you've got radials in both sides. You have the femoral artery here, and those are actually a little more difficult to palpate. Mostly the location is just not awesome. We also have the popliteal, which is kind of in the back of the leg here. You can also palpate them down in the feet, which they didn't talk about. The dorsalis pedis down here is a pulse that we can palpate right on the top. We've also got the brachial. This is where you palpate the pulse in kiddos, and that's kind of on the inside of the arm. The carotid, which is up here in the neck. So you guys take a few seconds here and just use 2 fingers and put them up on your neck and try to feel your carotid pulse. So hopefully, sometimes it takes a little while to feel, but it's just to the right or left of the trachea. You can usually feel it pretty well. It's a pretty strong pulse to feel. So those are your pulse points. Oh, here it is. There are some in your feet. So you've got the dorsal pedal, or the dorsalis pedis, dorsal pedal, same thing. The posterior tibial is kind of in here. It's posterior and slightly inferior to the medial malleolus, which is this bumpy thing that sticks out. So try feeling those as well. So what do we care about pulse? Well, what we're going to count is the rate of pulses that we feel. Ultimately, this lets us figure out how many times in a minute the heart is squeezing. So we do calculate it in beats per minute, so the number of pulses that you feel per minute. You assess the rate. So in an adult, normal is around 60 to 80, in a child, 80 to 110, and an infant, you're all the way up at 120 to 150. The rhythm is usually regular, although it could be irregular. And the quality, so it could be a full, which is kind of normal. It could be weak or thready, and it could be bounding, which is just, man, it's just really going away. It's just pushing, squeezing through. It feels like the pulse is just going to jump out at you. And we always want to report the 3 descriptors. So you want rate, rhythm, and quality for the pulse. Always, always, always report all 3. So it's 80 beats per minute, strong and regular, or full and regular. So here are a couple terms. Tachycardia, hopefully you can take this apart. Tachy is fast, cardi is heart. So a fast heart rate. We define this to be faster than 100 beats per minute in an adult. Bradycardia is a slow heart rate, and we define that as slower than 60 beats per minute. The next vital sign is respirations. We start with the rate. The normal adult respiratory rate is 12 to 24 respirations per minute. In a child, it's 20 to 28, and an infant can actually breathe around 30 to 70 respirations per minute at birth, and for about 3 to 4 days after birth. That's normal. By 6 months, it's around 30 breaths per minute. Tachypnea is faster than normal respirations, and bradypnea is slower than normal respirations. And with respirations, we're going to calculate the rate, which we already sort of talked about. You're also going to assess the rhythm. Is it regular or irregular? And when we talk about trauma and head injuries and some other conditions, there are actually some patterns. So is there any pattern to the respiration? And what's the quality? Full, deep, shallow, labored, noisy? So an appropriate way to report respirations would be the respirations are 14, regular, and non-labored. So again, always report and document all three.